Good afternoon, Franklin Township. This is PJ Parker from the Franklin Reporter and Advocate, and I am so honored to be today at Cedar Lane Animal Clinic with a veterinarian who I have known for decades, Dr. Jim Bacon, who's celebrating 50 years in the practice of veterinary medicine. And he brings tears to my eyes. I can recall, and I have to share this with you, Franklin, because it was the most loving, caring gesture on the part of a veterinary professional. My very first Shih Tzu was the runt of the litter. She was 7 pounds maximum, and she had a congenital kidney failure. And we would take her, I called it dialysis, but she had her kidneys flushed 3, 4, 5 times a week, and nothing worked. And one night, it was not working to the degree that she was screaming. And by 2 in the morning, I didn't know what to do. And I got Dr. Bacon on the phone. And he stayed up with us all night long, suggesting this and suggesting that and helping us to calm her. And she did calm down. She listened to his voice and calmed down. This is a little puppy. But for that kind of dedication to be in anyone's mindset on any level, any walk of endeavor, but especially when you're dealing with an innocent who can't speak for him or herself, who has a great friend in a professional such as Dr. Jim Bacon. So I do want to honor him today for his 50 years of many, many more stories with many, many more animals right here in Franklin Township, 1760 Easton Avenue, in the shopping center that we're all familiar with, right at the traffic light at Cedar Grove Lane. They're open 9 to 6, Monday, Tuesday, Thursday, Friday, Saturday 9 to 1. They're closed on Wednesdays and Sundays, and we happen to be here today to celebrate this wonderful anniversary. And without any more words from PJ Parker, this is Dr. Jim Bacon, and I am so proud to have known you for as long as I have, and for the love and the care and the professionalism and dedication you've shown not just to my animals, but to so many animals here in Franklin. Tell us more about Jim Bacon. Tell us, Jim Bacon.
Well, I grew up in rural Kansas, little dinky towns. In those towns, I often tell people the 4, important people in the town were the pastors, priests that help people keep the faith. There was the little town sheriff, like the Andy Griffiths of the world, and the little country doctor, and a veterinarian. And the veterinarian helped in a lot of ways maintain their livelihood, especially through the Depression and hard times. And they helped people, often didn't get paid, except maybe in something to eat.
And lots of hugs and kisses.
Yeah, I grew up with the thought that this was to help people. And hopefully that's the way we always remain.
We just had you share a tiny little story about the puppy who you gave kind of free rein at the end of a lead in your backyard, but one Sunday...
Well, that was quirky, and I was probably, would have been about 4 or 5 years old at that point. But, and again, very few dogs were in the house all the time. They were mostly in the backyard. If you had a fence, if you didn't have a fence, and many of us didn't, for a lot of different reasons, but didn't. Sometimes when we weren't home to watch them, why, they were on a tether to keep them out of the road and keep them out of mischief. And we had left Corky in the backyard tethered on a Sunday when we went to church. Church was only about 5 blocks away. This was before air conditioning, so doors were open, windows were open. Kansas gets pretty warm in the summer. And Corky managed to chew the tether in two. My father was a deacon, and all this happened just at the time that he was down front getting ready to serve communion to the congregation, and Corky came wandering down the aisle, dragging what was left of his tether, sat down beside my dad, and of course, this is such a little town, everybody knew whose dog it was, and he just sat there and waited, and my poor dad had to, red-faced, had to walk Corky back home.
Well, how sweet. He wanted to go to church.
Yeah.
That's such an incredible story. And he knew where to go, which is just amazing. Amazing. Were you the veterinarian at that? No, you were 4 or 5 years old, so you couldn't have been. But did that give you any sort of a desire to pursue veterinary science and medicine and healing at that point?
Yeah, probably. We were always fond of critters, whether they be dogs, cats,
Snakes.
yeah, everything. Ponies. We had my grandparents had about 40 head of ponies at one point, and I was really into horses growing up when I was about 7 or 8 years old. I think my granddad wanted me to be a vet, so he had me ride with one of the country vet in Yates Center, Kansas. And I shouldn't tell the story, I guess, but Dr. Stauffer, we went out to see a cow that was down out on the prairie, and we'd follow him in a pickup until they sort of slowed down a little bit, and then he would get out and try to throw a rope on him. But bless his heart, he was rather heavy.
Oh, dear.
He couldn't run quite fast enough, and every time he'd throw the rope, he'd pull his pants all up, and he'd go out and he'd throw the rope, and his pants would fall. And we must have chased this cow, I don't know for how long, and she was pretty sick, but we were still chasing him. So I said, well, I can rope it. I mean, I'm 8 years old, but we were roping stuff off these ponies. He said, are you sure? Yeah. So this is something nobody would do today. He takes an 8-year-old kid, sets him on the driver's side front bump fender of the truck with a rope. The cows aren't too afraid of the trucks because they feed from the trucks, baled hay in the wintertime.
So that's a positive.
So we got close, threw the rope on him. He jumped out because I wasn't heavy enough to hold the cow. And that's when he told me, you got to be a veterinarian.
Wow. So that was the beginning for you. How did that make you feel?
Pretty good. Yeah,
but did a light bulb go on and say, wow, he's right? Or that feels like me?
I can probably do this.
Wow.
Yeah.
Well, the science changed greatly from roping.
Yeah.
It became more of an intimate environment in that cows weren't coming into your office.
No, because, and I still, when I finished college at the University of Missouri, the thought was still I was going to do livestock and horses. But this was 1969, Vietnam's going on. Wow. Everybody went into the service. And most of the veterinarians were doing either like USDA food procurement inspections, or we were working with sentry dogs that were going over to Vietnam. And I ended up getting discharged from Fort Dix here in New Jersey. Thought I would be here for a year, maybe two, saving a little money to go home and start a practice, one thing or another.
How did you get to Franklin?
Well, I worked in a practice right when I was getting out of the Army up in Bayonne, and then down in Lawrenceville, and then at Raritan Animal Hospital, and then my wife and who was director of the library over in Edison, and it seemed like there was not a veterinarian here. The veterinarian that had been here had left the area and closed the practice, and this seemed like a good place to start an independent.
Have you been at this location the whole time?
Yes.
Wow.
Yeah, 50 years.
Wow.
Yeah.
Easton Avenue's changed a little bit.
It has changed a lot. Yes, yes.
Well, fundamentally, the river's still right there.
Yes. Yeah, those kind of things are still here, but oh my gosh, how it has developed over the time.
And speaking of the development, when you started practicing here, what was the primary focus of your practice, and has that changed?
Yeah, we did almost everything. There weren't any emergency facilities. The only major, I guess if you wanted to think of it as specialty hospitals, were the Animal Medical Center in New York and Cornell Veterinary College and the University of Penn Veterinary College. Other than that, there was nothing. And
Nothing local.
no. And so we did everything, 24 hours a day, just round the clock on call. But things are different and better. Like I think we were talking a little bit earlier, because we have more of those specialty facilities now. We're not trying to be an expert in every field. It's more like we're the general practitioner, but not necessarily still the cardiologist or the oncologist or the internal medicine specialist that are treating a specific category of problems. Because they're treating a specific category of problems and have specialty training, they're able to do such a better job than we were ever able to do, trying to do it all.
Well, not that you're trying to do it all, but someone who brings an animal in here and the symptomology is diverse, and somebody has no idea, why is my dog coughing? He seems to be wobbling a little bit. Does the diagnostic that you provide here lead someone to more of a specialty situation?
Sometimes. Sometimes, yes. Just like us going to our internist or general practitioner, sometimes most of the time probably, we have an answer. But sometimes the test results don't give a definitive answer, and you need more maybe specialty imaging, an MRI, maybe a CT scan or something that a general practice size is just not able to maintain. And then those types of things get referred. If we do find things like certain forms of maybe cancer that are not going to be just surgically remove a tumor, and could require chemotherapy, something like that, often those are referred. So pet family members, understand what
Mhm.
options they have,
Mhm.
and then they have the opportunity to pick and choose how much or how little seems appropriate. Not just, we all have different life experiences that cause us to make decisions that way. It's not necessarily, I don't want to anyone to misunderstand, it's not necessarily an economic decision. It's based on what they feel is quality of life and comfort. It's not like you can set a pet down and verbally explain to them what's going on and have them understand. We don't want them to be painful, and we don't want them to be miserable.
But we do want them to have a fighting chance on whatever it is. When they walk in the door here, they have the opportunity for wellness diagnosis.
Yep.
And if there's just a glitch in the wellness, then you have the expertise from all of the years of you doing all of these specialty modalities, that you do have the knowledge and the experience to direct further. So you're the first stop.
Yep, and we have over 50 years, certainly, we've seen a change in our ability as far as preventive medicine, immunizations. I mean, geez, 50 years ago, we had a diabetic patient. They rarely got treated.
Wow. Was there no treatment?
There just wasn't a good understanding of how to treat or how to care for them. We do a really good job with them now.
Well, you've always done a really good job
Well,
on the levels that you have always been expertise in. And yes, I appreciate that the specialties have evolved, but you are the person that people come to who they trust to tell them the truth.
well, and that's what veterinary medicine should be about. It should not just be about medicine. It should be helping people. That's what we should all be doing, whatever profession we're in, is helping others.
And helping those who can't help themselves, who are dependent on us. They're dependent on us as pet parents to make the right decisions, to take them to the right persons who can help, who can make the diagnosis so that the rest of the help might be obtained. And that's always been your goal. That and
so.
you've done that, and your reputation is, I won't say it's over the top, sparkling and loud. You have quiet. People trust you,
Well,
and that's born out of everything that you've just been speaking about.
and we've been lucky to have people working with us that are also here to help others. That's important. This is not something that I've done by myself. There's others here that have been a big part of this.
Well,
They
it's the
create
heart.
memories.
Yeah, we create memories, absolutely. And again, Franklin, my earliest experience with Dr. Bacon, when we had just begun our adventures in puppyhood, I will never, ever forget your kindness that night. For hours, Franklin, all night into the wee hours of the morning, to help this little puppy who did not make it. But that night, she was comforted, she was soothed, she felt better. And it was because of the patience of Dr. James Bacon, and I will never, ever forget that experience. And my gratitude for that little puppy's moments of comfort that you were able to impart for her. It was extraordinary.
Thank you. Thank you.
Truly, truly, Franklin. This man has heart, he has skill, he has knowledge, and he is open for, as we talked about, well puppy visits. And stage one, when you walk in the door, to find out perhaps the rest of the story. Is there anything else you'd like people to know about you and your last 50 years?
No, it's been a good long run. And yeah, it's been a good run.
Okay. Well, we hope you're going to be around for another 50 years, but don't tell us how many more.
Okay. Promise.
Okay.
Yeah.
But again, it's a milestone. We are so thrilled that you've been part of this Franklin Township community, and certainly all of the animals who are blessed to know you. We thank you.
It's been fun.
Yes.
It's been fun.
Again, Dr. Jim Bacon, and the hours again, Franklin, Monday, Tuesday, Thursday, Friday, 9 to 6 p.m., Saturday, 9 to 1, closed Wednesdays and Sundays. The phone number here is 732-469-5133, and it's right in the shopping center, that strip kind of up the hill at Cedar Grove Lane and Easton Avenue, and they've been here for 50 years. So happy anniversary, Dr.
Thank
Jim
you.
Bacon. It's been
Thank
our
you.
honor. Thank you
Thank you.
so much.
Thank you, guys.
This is
I appreciate
PJ
it.
Parker and Bill Bowman and Dr. Jim Bacon.
Thank you.
Thank you, Franklin, for tuning in. We'll be back.